Let's discuss wandering atrial pacemaker now. So our objectives for wandering atrial pacemaker. Identify the pacemaker site or sites in the cardiac conduction system for a wandering atrial pacemaker. Understand why the P waves will vary morphologically from complex to complex. Understand why each P wave has its own unique PR interval. Recognize a wandering atrial pacemaker on the ECG monitor, and understand why a wandering atrial pacemaker rhythm is irregularly irregular. So one thing to remember about wandering atrial pacemaker is that it is an irregularly irregular rhythm, meaning that it is going to have an irregularity that's really not predictable. It's caused by different pacemakers in the atria itself, hence the name wandering atrial pacemaker. So you've got two kinds of wandering atrial pacemaker. The classic definition, which is caused by slight variations in the pacemaking sites within the SA node itself. The P wave in normal sinus rhythm can vary slightly in their morphology. Then you've got clinical variations where it's caused by at least 3 different pacemakers. So the purpose for this lecture, we're going to mainly be discussing the clinical variation, because one of the hallmark signs of a wandering atrial pacemaker is that you've got to have at least 3 different P waves that are different in size or shape or morphology on a 6-second strip. So we'll look at this really quickly, the classic wandering atrial pacemaker, and it's just because it's coming from a slightly different area in the SA node, so it might be just a little bit different, and that's something you may see pretty regularly. This example will show it. You see just a little bit of a difference in the P waves here, but they're not significantly different. But the clinical variation, what's going to essentially happen is that you've got different pacemaker sites, so different cardiac cells that are creating a action potential that are going to cause the atria to contract, which when the atria contracts, it's going to have a P wave, and the P wave, the variation of the P wave, is all based on the position or the location of the pacemaker. So this is just really a very busy graph that's showing what it's going to look like on the final strip. So in this clinical variation of WAP, in this example, you've got 3 different pacemakers. And so what it's showing is that pacemaker 1, indicated in blue, is from one area of the atria. Pacemaker 2, indicated in pink, is from another area, and pacemaker 3, indicated in green, is from another area. And so you'll see that the first complex, the pink fired; the second complex, the green fired; third complex, the pink fired. You have a little bit of a irregularity there, and then you see the blue come in. And so basically what it's saying is that these are all going to be firing, and so whenever they make it through the AV node to the ventricle, then you're actually going to see this show up on the monitor. So your rate usually is 60 to 100. Rhythm is going to be slightly too irregularly irregular. Is there a P wave before each QRS? Yes, usually. And it's going to change in size, shape, beat. What's the length of the PR interval? And that's going to be variable. And the QRS complexes should all look alike, because again, there's nothing wrong with the QRS. The ventricle is going to respond to every conduction that goes through. So just a real quick true-false question. A wandering atrial pacemaker can have an inverted P wave. Is that true or false? And of course the answer is true, because based on where the ectopic pacemaker is, if it's really low, then it could have what's called retrograde conduction, which causes an inverted P wave. So the key thing that we need to be looking for, again, is going to be at least 3 different P waves, whether they're inverted or upright. So it's all going to be essential that you see that. So differential diagnosis: COPD, respiratory failure, atrial enlargement, electrolyte abnormalities, or other stimulants like nicotine, caffeine, alcohol. So in this case, this is just an example just showing you that the little stars here indicate certain sites of atrial ectopic pacemaking. And if you look on the monitor strip here, you'll actually see that you've got different P waves. And as a matter of fact, it's actually getting a little bit flatter as you go across. So the circles here are highlighting those P waves. So on this strip here, what's my rate? 1, 2, 3, 4, 5, 6, 70. My rhythm is irregular. You can tell that from your R to R. Your P wave. So we're going to say that our P wave is differing in morphology. You can't really get a PR interval because you've got different PR intervals across the board. My QRS looks like it's within normal limits. But the biggest thing, again, that we see here is that I've got at least 3 different P waves showing up on a 6-second strip. So another question. You will recognize a wandering atrial pacemaker because of and of course the answer is variable P wave. At least 3 different P waves. So some examples here. So you see the difference in the P waves. I've got this guy right here, and then I've got this. So I've already got at least 3 different P waves. My rate is 1, 2, 3, 4, 5, 6, 7 is 80. So as we'll see, that's going to make a difference when we talk about multifocal atrial tachycardia. And so with all the other parameters, this is a wandering atrial pacemaker. Now this is an irregular rhythm, and if you notice, this arrow right here is actually talking about the P on T that we had talked about with the premature atrial complexes. That's why you've got that big morphology there. But you notice here you've got several different P waves, which indicates a wandering atrial pacemaker. Same thing here, wandering atrial pacemaker. It's again irregular. Wandering atrial pacemakers are typically not clinically significant. The patient's usually asymptomatic. You could see it caused by digitalis toxicity, and then you may have some other issues as well. But ultimately, with wandering atrial pacemakers, it's something we'll identify, but there's usually no treatment for it.